So I'll often draw the anatomy of the neck for patients here at my desk when I'm doing consults. You know, the ideal neck has a bit of a jawline, and then the chin comes and has a little bit of a horizontal segment to it before it becomes more vertical. So really that's a nice shape. You know, these are lips up here, nose up here. That's kind of what we're trying to achieve in most people. Not everybody has that type of neck. Sometimes the chin is sitting a little too far back, and that obstructs or that prevents that nice horizontal portion. Sometimes the position of the chin is fine, but this neck starts coming down here, which we don't love. So why does that happen? And it depends on the person, but sometimes the chin can be small, but more often than not, what we find is there's a little bit of fat. I'll make it yellow because fat kind of is yellow when you take it out. But there's a little bit of fat that sits underneath the skin, and that's the fat that can be removed when we do liposuction. To be honest, it's not a lot. And most people don't have a lot of fat underneath there. And I think that that fat actually makes the skin look very smooth, so I don't love taking it out. Underneath that fat layer is a muscle layer, and the muscle is called the platysma. And that platysma muscle is one of the muscles of facial expression. It's not really a weight-bearing muscle, but when you flex your neck, you can see the bands of your platysma flexing. So that muscle sometimes hangs down a little bit more than what we want as well. But what I often find in patients who have a very full neck is that they quite often will have a fairly large amount of fat underneath the platysma muscle. So that's the deep fat. You can't get that out with liposuction. You can't get it out with enzymes like Kybella. You can't use cool sculpting for that. This fat has to be accessed surgically. Underneath this, there's also the digastric muscle that can be a little bit full. And there's also some glandular tissue. The front edge of the submandibular gland, a little more laterally, can sometimes contribute. So these are all things that can't be removed with energy-based devices. They can't be removed with enzymes. So we're left with trying to modify the shape of the neck by debulking these structures, and that's not easy to do. We have to do it through a very small hole. There's normally a crease that forms just underneath the chin called the segmental crease, so when we make an incision there, that allows me to elevate the skin off of the platysma muscle. Typically what I would do is I'd open this platysma muscle up to expose these areas. I would reduce this fat. Sometimes I'll reduce a little bit of the submandibular gland as well, and even some of this muscle in here. And so what that allows me to do then is take this muscle layer here, I will sometimes cut it, and then I'll actually pull it up to here. And when I do that, it allows me to bring this muscle layer up to here. So that, of course, brings with it the skin and fat. So what's left behind then is the skin coming like this, with that really nice layer of fat that we really want to leave behind because that's what makes the skin look smooth. And so what we've done is we basically subtracted the deep structures so that there's a place for us to move the platysma muscle. If you don't create a space for that muscle, all the pull in the world and all the tightening in the world isn't going to overcome the bulk that's there that's preventing it or that's pushing it down. And so that's an example here. I'll show you. This patient has a more obtuse shape to her neck. Her chin is in a good position, doesn't need to be modified. But what I did was I made a small incision here. You can maybe just see the edge of it over there. The platysma muscle was separated to access that deep pocket of fat. I resected some of that fat and some of the glandular tissue along with shaving down one of the muscles that was deep there. That creates a space for me to tighten her muscle. The muscle is then physically sutured. If you look at this diagram here, there's actual sutures that are suturing the platysma down, forcing it to stay up. So this is an active procedure. This is not just removing bulk and hoping for the best. I'm actually physically attaching in a very firm way with deep stitches. I'm attaching that platysma muscle in an upward direction to really define that neck and give her the horizontal portion of her neck that looks good. So this is an example of that. That platysma muscle has been sutured up to the underlying muscles and the floor of her mouth fascia. In addition to that, I also use a very, very heavy stitch that goes from the back of the ear to here that further suspends this and helps to define her jawline. So this is a great case. Young woman with a neck shape that she doesn't love. I think this looks really good on her. It makes her look a bit more fit. She's really beautiful. It's interesting how just taking that feature out of the way sharpens things up for her. I think that looks quite good. So here's an example of what we might do to improve the shape of the neck. My nose is terrible up there. But here's an example of someone who potentially has a smallish chin. And so bringing the chin forward in a case like this so that the chin projects a little further. So here's an example of a case where the neck shape isn't ideal, partly because chin might be not quite far enough forward. So bringing the chin forward in a case like this to here can help with the projection, in addition to tightening this up. So again, we mentioned before, fat, I'm gonna make it orange this time, probably shows up a bit better. But fat underneath here is usually just a pretty minor contributor. Platysma muscle, deeper fat is probably more of an issue. So in a case like this, if we can bring the chin forward a little bit and remove some of the fat, tighten up the muscle, I think that can sometimes give an even better result. So here's an example of that. You'll notice she has a little bit of an obtuse shape to her neck here. I think ultimately the chin could come forward a little bit. So what I did in her was I put in a chin implant to bring this forward. I removed some of the deep fat, sutured the platysma muscle up onto it, and then I used a suspension suture which goes from behind the ear to the point that we want to use to define the shape of her neck. So it's sort of this mentocervical angle here, and then that suture spans this area and kind of tucks up underneath the jaw to sharpen the jawline a little bit too. I didn't use liposuction in her. I wanted to keep the fat underneath the skin to make the skin look smooth. Young patients have lots of fat under the skin. That's why they look young. I don't think it's a great idea to take that fat out. Reshaping the neck from inside though, I think works quite well. And sometimes, as I mentioned before, if bringing the chin forward can also help an elongated horizontal part to the neck, it can be very powerful as well. Obviously, you don't want to put a chin implant in there if someone doesn't need it, but it certainly can be an option. So in a case like this, I find it very helpful to do a pre-consult for patients like this. What we usually do is we'll get patients to call us and tell us what they're interested in having done, what their ultimate goal is, not necessarily what procedure they want, but what they were trying to achieve. And when I did a photo review for her, I did sort of notice that bringing the chin forward would probably be helpful. I don't think she has a lot of excess fat. I think it's just the natural shape to her neck. So I thought sharpening the neck by tightening her platysma and perhaps adding a chin implant, she could potentially do that with fillers as well. I thought that was going to be the right thing for her. So that prepared her for the consult. She had appropriate questions and she was, much more informed when I sat down to talk to her than if she had sort of come in saying, oh, I want to have liposuction or I want to have cool sculpting to give me that result when that's just not realistic. So one of the important things about this type of surgery is that it's pretty substantial. This is not a simple in-office procedure. These are done with anesthesia. You don't need to be asleep, but we usually do conscious sedation for this. There are some significant risks, the most important one being bleeding underneath the surface. So I always will put drains in. There's a little drain that comes out from the side, and I like to keep those in for 2 days in these particular cases. Occasionally, I will suture the skin down laterally with some stitches that go through the skin, and those will come out after a couple of days as well. The recovery from this has different parts to it. I don't want patients doing a lot of physical activity, things that are going to flex their neck or cause them to extend their neck excessively when I've done a pretty sturdy repair in here. So physical activity has to be a bit restricted for probably 4 to 6 weeks. They can get some exercise, but just not things that are going to force movement of the neck substantially. The other thing is this is never perfect. I think this patient looks great, but there's probably some little irregularity. She has a little scar here and there. Sometimes we get a little bit of bumpiness along the mandible that can take some time to disappear. So you do have to expect some little puckers and lumps and bumps for the first little while. It doesn't look this good at a week. So you do have to be a bit patient with this. Not all necks are fixable. There is some anatomy in the neck that I can't modify. So for example, where the Adam's apple is, that's the laryngeal complex. Sometimes that sits very far forward in some patients and there's just no way around that. It isn't fat, it isn't muscle, it isn't glandular tissue, it's just their natural shape. I can always make an improvement, but I can't necessarily get everybody's neck to look this good. Keep in mind, I'm working with your anatomy. I'm not shaping a block of wood. So there are some limits to what can be done. I think in general, after a few months, most people have all the little irregularities, lumps and bumps settle down and are pretty happy. It's never perfect and you have to think about surgery that way to a certain extent.